Health Department is urging the public to be vigilant following the detection of cholera cases in Limpopo. So the first case was confirmed in the Musina Vhembe district, whilst a second case was detected at Capricorn District Municipality. The department says it is working closely with the Border Management Authority and has intensified health screening at Beitbridge border post to mitigate against the imported cholera cases from Zimbabwe. Zimbabwe is currently battling the outbreak of the disease, which has so far claimed over 200 lives. So we're going to be joined via video link by Deputy Minister of Health, Dr. Sibongiseni Dhlomo. Dr. Dhlomo, good afternoon, and thank you for your time with us here on the SABC at this hour.
Good afternoon, ma'am, and good afternoon to your viewers all over the country.
At this point, as we're speaking, what is the situation on the ground? What are the numbers reflecting in terms of cases, suspected cases, and deaths?
Ma'am, we should not forget that once upon a time, South Africa was a country with endemic cholera, but we don't have that anymore. Part of that is the strides that our government has made to provide safe and clean water. Of course, there are pockets of areas where we still experience that. That is why we have a strong campaign to say if there's any suspicion of water not being safe and clean, let us err on the side of boiling or also on the side of actually making sure we have bleach. You would recall we had an outbreak of cholera again last year in Hammanskraal, and that also was imported from Malawi. This time around, I was starting the first case, a 43-year-old truck driver who was on his way from Free State, and in Welcome had a diarrhea and vomiting, and decided just to carry on, and then around Musina, hoping to get into Zimbabwe. He's a Zimbabwean truck driver. We were not able to. He went into a lodge, and thank you very much to the lodge owner, who then, because of the suspicion of this diarrheal disease, took him to the hospital, and in the hospital they did confirm that it is cholera. And another second case also in another hospital in Limpopo. So we are actually saying we are very much confident that the Border Management Authority in all our ports will continue monitoring. But these two cases were cases that at the time they went through the border had no signs and symptoms of cholera. So, but let's be vigilant as South Africans that this is a communicable disease. Let us continue to wash hands and clean and make sure that when we're going to touch food and also coming from the bathroom or toilet, we have washed our hands. Because this is a communicable disease, we will also be able to follow and trace where has these two patients been.
We seem to be struggling with technical issues regarding the sound. Deputy Minister of Health, Dr. Sibongiseni Dhlomo, weighing in, obviously just trying to give us an update from the Health Department, urging the public to be vigilant following the detection of a cholera case in Limpopo. So we'll continue to monitor that as it unfolds.